Well, it's emerged that the worst place in the world to give birth is the Democratic Republic of the Congo. That's according to Save the Children's 14th annual State of the World's Mothers report. The London-based charity compared 176 countries in terms of maternal health, child mortality and education. At the bottom five, all the bottom five rather, are in sub-Saharan Africa, where a baby is 7 times more likely to die on its first day of its life than anywhere else. Well, for more on this very disturbing report, I'm joined by Save the Children SA Advocacy Communications Advisor, Allan. Thank you for joining us, Karen. In the DRC, you have a 1 in 30 chance of dying as a mother. Given the medicine that's available in this world, it almost seems like murder. It seems incredible.
Absolutely. I think there's a lot of cost-saving solutions that we need to be applying. So there is, if we get the message out as to how to save lives, that it's not all about expensive, labor-intensive methods. And the report clearly outlines some good, cost-effective, low-cost, proven solutions to saving newborn lives.
Are these women dying because they don't get to the hospital in the first place, or they do get to the hospital and they don't have these basics that you're talking about?
I think it's a combination. Some women and children are dying because of a lack of skilled attendance in birth, but then some of these problems also related to, for example, infections, preterm birth, and we have some solutions like we have some steroid injections that we're recommending, so not expensive solutions to these problems. So it's a bit of a combination between getting the skilled healthcare to where people live and reaching people where they live, or the other way around, and also cost-effective treatments within facilities and communities.
Looking at this report, right at the top are a lot of the Nordic countries, the European countries that have focused on welfare. Right at the bottom, sub-Saharan Africa, Sierra Leone there as well, Niger. What about South Africa?
Well, South Africa is ranked 77 out of the 176 countries. I think what is encouraging from a South African perspective is that we have managed to decrease the number of children dying under the age of 5. I think that's largely due to prevention of mother-to-child transmission of HIV and AIDS, and also rolling out antiretroviral drugs to mothers. So we have made some progress, but unfortunately we still are faced with a huge crisis, which is the fact that 21 babies a day die on their first day in this country, and 21 babies dying on their first day is really totally unacceptable. It's an outrage.
That is an outrage. What about the mothers? What are the risks that they face?
And there's still too many mothers also dying in birth, and a lot of mothers are dying from preventable reasons, from complications in birth, and that also is related back to having skilled attendants, and reaching women and children in South Africa where they live. So although the report is somewhat favorable in terms of making progress, we still have a lot to do to make sure that no mother or child dies during birth in South Africa.
We don't have a lot of aid organisations on the ground. The UK has just pulled aid funding. But where can government step in? Is this possibly an argument for the national health system that we're talking about, for a really unified, concrete solution?
I think everybody has a role to play. Certainly it's about partnering with government to strengthen the existing health system. So sometimes it's not the fact that there is no clinic or hospital, but about getting workers to reach vulnerable women and children where they live. So I think there's a role to be played, a stronger role. Obviously, we want to encourage government to make sure there's less women and children dying, but also for NGOs who are training home-based carers and, educating communities about what exists in terms of healthcare. So I think there's a combination.
What about the women themselves? Is there a huge lack of education where they don't know what to do? They don't know where to go and what's needed if they get into trouble?
I think
and how do you deal with that?
Certainly, I think that is an issue that I think, there's some space for educating communities about what's available and what their rights to health are. So sometimes I think, obviously, you don't realize the urgency. For example, if you've had complications of birth, that how risky the first day of a child's life actually is. So the first day of your life is the most dangerous day, and the most likely that you may not make it. So I think that educating people about the risks associated with birth and that very first day, and obviously then the first month and the first 5 years. So when is it life-threatening, and what services can be reached, and what economical solutions can be used to save children's lives and mothers' lives.
All right, thank you for explaining that report. So South Africa, 77 out of 176 countries. Thank you for your time. Advocacy Communications Advisor for Save the Children SA, Allan.
News that moves. eNCA.com.